Hi, it's Dr. David Green, CEO of the Arizona Pain Network. Today's topic is the lowdown on a procedure called a kyphoplasty. Okay, K-Y-P-H-O-P-L-A-S-T-Y, kyphoplasty. Back in the 1980s, there was a procedure invented called a vertebroplasty. Now, let me give you the quick rundown here on the spine. This is looking at a spine from the front. These bony areas are called the vertebrae. Okay, these are vertebral bodies. As we age, our bone density can go down, 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 and that develops what's called osteoporosis. It increases in women very quickly after menopause. Men get it just as well, but a little more gradually over time. And what can happen is it can get so bad that even with regular walking or sneezing or something like that, the strain of that can cause the bone to fracture. And that's called a vertebral compression fracture. And essentially what happens is you get some loss of height because of the fracture, increase in pain. And the only treatment that we had, before the 1980s was basically to put the patient in a brace, give them some pain medication, and maybe keep them on some bed rest for a while. The problem with that is you can develop pneumonia. You can you get more and more fractures. You can start to end up getting like this with your spine. It can compress on your stomach and your lungs, and it can end up getting in a spiral, and it shows that there's a 25% increase in mortality of the way we used to treat these patients. Okay, so now the vertebroplasty came along in the 1980s, and basically what that involved was under image guidance, fluoroscopy, which is real-time x-ray, pain doctors were able to, or interventional radiologists, were able to put a catheter into a person's fracture and inject bone cement. The same type of bone cement they use for total joint replacement. Okay? Now, that bone cement would move itself in between the fracture areas, harden up, and basically act as an internal brace. It didn't add any height to the height that was lost, but it was very, very impressive for pain relief, about 90%. Patients were able to get up very quickly afterwards, start walking again. So in the early 2000s, around 2003 or so, an invention was made, an improvement on the vertebroplasty, the procedure called a kyphoplasty. So what happens during a kyphoplasty procedure? Well, it's the same as a vertebroplasty for the approach, but it's different as to how it's performed. The approach for a kyphoplasty is the same as a vertebroplasty, but the procedure is very different. So the pain doctor will, under image guidance called fluoroscopy, put the catheters in, and they go around the spinal cord and then into the fracture, the vertebral body. And once in, x-ray shows that the positioning is accurate. The pain doctor will, instead of just injecting the cement like with a vertebroplasty, they inflate a balloon filled with saline. And basically that pushes the bone fragments up, down, to the sides. It creates a bony void, and it can help restore the height that was lost from the fracture. And that balloon is removed, and in its place, bone cement is put in there, and that hardens within about 20 minutes, and it creates an internal brace, just like a vertebroplasty, but you get the height back. Okay, so the whole procedure takes around 45 minutes. Most patients go home the same day. Some stay overnight if they have other comorbidities and they're older individuals. What are the results? Well, the results are about 90% plus, good to excellent, for pain relief, which is dramatic. The person may still have some muscle spasms for a few weeks afterwards, and that just slowly dissipates, but most of the pain goes away very quickly. In addition, increase in function, so they're not relegated to bed, don't have to wear the brace anymore or take a lot of pain medication. So it can be very helpful with avoiding that downward spiral with being in bed, getting bed sores, pneumonia, things like that. Okay, what are the risks? Well, there's always a risk of infection, bleeding, nerve injury, anesthesia complication. Now, there is a risk of the bone cement going somewhere where it's not intended to go, specifically into the spinal canal. Now, if it hardens around the spinal cord or a nerve root, it can cause a neurologic injury, potentially paralysis. It's unusual, but it can happen. Now, the bone cement gets very hot as it's heating up. Okay, so that's a problem if it's near a neurologic element, because as it heats up, it can burn the spinal cord or a nerve. The incidence of that happening is really, really low, but, it happens. Okay, so all in all, it's a spectacular procedure, very low risk, outpatient, and it's covered by all insurances. Visit us today at ArizonaPainNetwork.com. There's a ton of educational information on our site. There's locations of all our treatment offices, as well as some bios on the doctors. And you can see the phone number on the site as well to call to get in for treatment. Thank you very much for watching.